because we would anyway.
Oh, yes.
Oh, we
Right.
do.
Yes, we do.
Yeah.
And that's how we get through the day.
But we don't want somebody dictating how many patients that we need.
right.
We have to make that decision.
Right.
And then we need the funding for education. I'm sorry, I'm going to jump back. Funding for education, so that's the Title VIII Nursing Workforce Reauthorization Act, and that we want that funding to be put out until 2022. Isn't that right, ladies and gentlemen?
Yes.
Yes.
Hasn't been reauthorized in a few years, and it's critically important to bring in new workforce. It's also critically important to fund ongoing education, advanced education for those of us who already are nurses. Because the big talk is about the generation of baby boomer nurses who are getting ready to retire, and then the burden will fall to the newer generations of nurses who are dealing with up to a 2 million nurse gap between now and 2022. And I think what people don't talk about a lot of times is what's going to happen is going to be the secondary loss, which is the loss of our generation of nurses who will not be able to tolerate the burden if new nurses aren't trained and brought on board very quickly.
Right.
No, and that's something that he's definitely been supportive of every year during the appropriations process. That's a big priority for our office.
We appreciate
So I know that he wants to see the
Thank you.
program reauthorized as well.
Yes, please. Thank you so much. And then the Addiction Treatment Access Improvement Act of 2017. Somebody else jump in here because I missed
HR
this.
6, I believe, and they're voting on tomorrow.
And they need to
Say no to the Dunn amendment.
What it does is it strips away prescriptive rights for advanced practice nurses. We leave 3 categories of nurses. So in order to be able to deliver that care, to have access to that care, we need all of those APRNs to be able to practice to the full scope.
Especially
Which
in rural
Dunn,
areas where doctors
if
are
they vote
less-
for the Dunn amendment, it would strip that away. So
Right.
we'd like for him to be opposed to the Dunn amendment.
In the rural areas in Virginia, I know UVA, we send, once a year, we send a group of volunteers to WISE in Southwest Virginia, because Virginia is very poor in some of those areas. Some of those patients never see health care. And we have volunteers who go there once a year to provide health care once a year. So if there are advanced practice nurses in those areas, they can prescribe, to prevent opioid addiction and teach people how to cope with it. I know I'm not being very articulate again, but you know what I'm trying to say. So we really want support of
Yeah,
that tomorrow.
I think if anything, he'd be supportive of allowing APRNs to practice the scope of their practice,
Yes.
especially in rural areas.
Yes.
So the Dunn Act, I think, is proposed by physicians.
Yes.
Nurses
Yes, there
know the
is.
patients, and we need to extend what they do. We need to contribute to what they do as well. We need, to be working together and not opposed to each other.
There's a case to be made, right? And this is what the case that they're trying to make, this Dunn amendment, is saying, well, we're going to leave some advanced practice nurses with prescribing rights so that they can assist with this opioid epidemic. But what it doesn't talk about is all the other APRNs who currently do not have those prescribing rights in the state, but who are being trained at the same level and who are able to assist. So basically you have a large group of people who are able to assist in the opioid epidemic, who are trained at the same level, who are not being allowed to prescribe the medications that they would use for that treatment. And this is, the Dunn amendment is kind of a way to strip that away, but still allow the bill to go through and to say, well, I support the opioid, fixing the opioid crisis. But we're going to amend it so we just don't use this gigantic, crew of people that
That's
they're...
just like saying a portion of the doctors we're going to withdraw that or withhold that prescribing capacity to, but the rest of you, small number of doctors can go forward and do it. That defies logic. What's the point in educating all these nurses out there through grants and loans and scholarships and so forth, only to handicap them?
Right.
And in some of the most with respect to some of the most pressing issues that face nurses and patients these days.
If we're very serious about attacking the opioid epidemic, it would behoove us to use all of our resources,
Absolutely.
not to limit what resources we can throw at it.
I'm in class with a bunch of people. Half of us are CNSs, half of us are nurse practitioners, right? The difference here is very clear. Either everybody in that class are going to be able to help with the opioid crisis, or half of them aren't going to be able to. They're going to be constrained.
One of the excluded groups is nurse midwives, who are going to be able to help women that have addiction while they're pregnant, which is going to help us passing that on to reducing the number of babies that are born. And also, we can have there with babies before
Just scan.
unable to prescribe anything.
How does a nurse midwife have anything to do with treating the opioid crisis?
They're taking
Because
care
all
of
of these babies, these moms are having babies addicted to
Nurse
opioids.
midwives practice in place
And
of an
they-
OBGYN in order to.
And I mean, it's really big. They
I'm
do
asking the
a
question
lot.
so you guys can tell him.
I knew that.
Because some,
We looked at you like, what program
because
are you
somebody's
in?
gonna,
Oh, no, I
somebody's
knew
gonna
that's
ask you,
why.
I'm assuming.
No, I knew that's why he
And
was
you know, I
asking.
would say too that Virginia just went through a similar thing with the practice.
That's right.
And the physician groups were, hunkering down, want to be kind of territorial.
And very rude.
Very rude about it.
Said that
And
they paid more money for their education than we did. So how do we get to do this when they?
So, yeah, it comes
Really
down
on
to
the same
the
team.
education
Let's work together.
level.
Yeah.
Let's work
And
together.
that they're capable of doing it.
We're a
They're
team.
capable of full scope of practice, period.
It's not really about the physicians or the nurses.
No, it's about the
It's
patients.
about that's it. And if we would all just
Crisis.
we want to get this. There's a power struggle that keeps
Absolutely.
people
All the
from
resources.
doing the job of taking care of the patient.
right.
And that's all we're talking about, is allow this thing to go through, say no to the Dunn Amendment, so we don't have power struggles getting people killed.
Tell your friends on the House side to say no to
Yes.
the Dunn.
Yes.
Do you have a copy of this?
Because we have a lot of people dying.
Not of that one.
You do now. And at the bottom it says do not support gun.
And then there's gun legislation. We want to fund the CDC to do research. The ANA wants to support
But I
that.
knew why you were asking.
We want to fund the CDC to do research.
We're not talking about passing gun control necessarily.
But we
ANA's
just,
I just like to know where he stands.
Right.
Yeah, no, he's supportive, and we were happy that we finally got the ban removed, and now the goal is funding the actual research so that we can accomplish. That was one success that we got accomplished last year, that having the ban. Now the CDC can do the research, but the problem is that they don't have the money, and especially under this administration, they don't have a specific funding account. There's no way they're going to do the research. There's no way they're going to go that extra step to find the funding on their own, so it has to be appropriated. So that's definitely the next battle that we're looking at, is how do we actually appropriate, is how do we convince people to actually appropriate this funding. I mean, it shouldn't take another crisis to prevent that.
no.
Very serious situation.
Resolutions, let's do discussion.
Yeah.
I've lived and worked in 3 countries. This is the only place I've ever worked in the world where a patient or a visitor would, when they're unhappy with something, have told me they're going to go home and get a gun. I was never told that in Ireland. And I grew up in the 70s and 80s in Ireland. And I was never told that in the United Kingdom when I worked there. I have 70-year-old ladies who tell me they own a gun at home. Why?
Right.
But then there's all the violence in it. It's ridiculous. I have a brother who lives in Chicago. Why does it happen there and kids are hurt all the time? So we really need to fund research. I mean, those only are my stories. Everybody has a story.
I'm
We
sure.
see it every
I
day.
got my
We
own
saw it this
stories.
morning. We saw it this morning on the TV. It's ridiculous.
If you live in this country, you got a story
Yeah,
about gun violence.
everybody.
So it's not that way everywhere.
I know. I know.
And the CDC supports nurses, so we can think that funding them is going to be in a positive interest for us.
So you have access right now to a bunch of experts with like untold amounts of clinical hours, right? What are some questions that you think you'll be asked that maybe you could ask us, we could give you an answer for, that might help you guys make a decision later?
In regard to these issues?
Yes.
I mean, no, I would say, we're pretty much on the same board with you with everything we talked about today. The one thing I haven't talked to him about is the bill with the hospital staffing and the advisory panel. I'm happy to talk to him about that.
Is there, I mean,
Do you
he's
understand
then
when we
gonna
say
have to,
acuity, what we are talking about whenever we say that to you? We want staffing based on acuity.
Explain that to me one more time.
Do you understand when we say to you, we want staffing based on acuity?
No, yeah, explain the acuity.
The acuity means, okay, you have, like they were saying earlier, you have patients in ICU or even on a step-down floor or med-surg, wherever. You're taking care of a certain number, but one gets very sick.
All right,
So
so
you have
based
to
on the actual
concentrate.
patient, yeah.
So the amount of sickness that they have is the higher acuity. So we need to base staffing on the higher acuity when we need to.
So the ICU might need a higher staffing ratio level.
Right, and ours change. Ours can change within 10 minutes.
Right.
You know, it can go. We have patients on certain machines that require 2 nurses to maintain it.
No, and I think that's totally right, and that's one of the issues I think that I personally, I haven't talked to the senator about these bills, but that's one of the problems I see in the other legislation is that it mandates specific staffing ratios,
Right.
and it's just like,
That doesn't work.
It won't. It hasn't. It
Congress
didn't
moves
work
slow
in
enough already, so
California.
why would we put,
Yeah, it didn't work.
Into law that may not change for the next 50 years.
No.
Right.
You know, and the type of technological advancements that would occur in that time period that could change the need
Right.
for
But
staffing.
this
So
bill that
it makes
we're
much more sense to
proposing, it
have-
makes much more
Yep.
sense.
to have
It's,
something that could be nimble, that could change with time.
and it would involve the people directly taking care of the patients.
In every environment.
Do you have a card or your email you can give
Yeah,
us?
absolutely.
Would
I'll
you be
take
the
it.
person we would?
Yes.
Have you got enough cards for all of us?
I do
Looks
actually.
like.
They told me they told me you all had an army out here. So
And then we were
bring a lot.
because we're the most honest profession, ethical. And how many voters? I mean, there are 4 million voters in the nursing
Yeah.
profession, so that's a lot.
The biggest profession, healthcare profession, actually.
Talking about staff invasions is really, really important, definitely in ICU and in all different departments all within the hospital. But I think like med-surg, all the units need to be equally. And I know there is a lot of for-profit hospitals and non-profit hospitals. A lot of the non-profit hospitals are kind of